Hello everyone. Just waiting to see if there anybody joining us for today's talk. Okay, hello everyone. My name is Kevin and I am one of the acupuncturists at Center of Balance based in Dinsdale, Hamilton. And today I'm just going to do a live talk on upper back pain. So I will be looking at the perspective in Western medicine as well as Chinese medicine, and looking at how we tackle this problem. Okay, so let me get into the topic. If you have any questions during the live talk, please don't hesitate to just ask the question. You can either type it and then I can see your comments and then I will respond to your comments, or you can give us a call after the live streaming ends, and I will try my best to answer your questions. Okay, just 1 second. I'm trying to sort out if I can. Okay, I was just checking to see if the video is actually public, so everyone can see it. Alright, now let's get started. So I'll start by introducing a bit about the Western medicine's perspective on upper back pain. So upper back pain is something caused by the spine or back muscles. In other cases, the pain may be unrelated to your back. Organs, including kidneys and the pancreas, can cause pain that spreads to your upper back. Upper back pain may be the result of an injury, pain disorder, or problem with an organ. It includes muscle strain. Okay, so a muscle strain is a tear or stretch in a muscle. If the strain occurs in your left upper back, you can develop upper back pain on one or both sides. So upper back pain doesn't always have to be both sides. It can be on one of the sides where you had injury. So the pain can, or symptoms can occur on one side. Okay. You may get upper back pain from a herniated disc. With repeated use or strong force, the discs that pads the spine can tear. So a disc that bulges out and rupture is called a herniated disc. If the disc in the middle or upper spine, you might experience upper back on one side. Upper back pain on one side. You may also have scoliosis. So scoliosis is a skeletal condition where your spine curves sideways. So mild curves typically don't cause pain. However, by middle age, scoliosis-related back pain is more likely. Then you have spinal stenosis. Spinal stenosis is a narrowing in the spinal cord canal where the spinal cord is located. It's often caused by bone overgrowth called bone spurs. You're more likely to develop bone spurs if you have scoliosis or osteoarthritis in the back. And you have kyphosis. Kyphosis is but if the curve is severe, it can cause pain in the lower and upper back. Vertebral fracture. A fracture in your spine vertebrae can cause upper back pain. Spinal fractures are more common in people with osteoporosis. People with this condition have bones that are weak and porous. If you have severe osteoporosis, a simple activity like reaching across your desk can cause a fracture. Okay. A vertebrae fracture can also happen after a severe accident, such as vehicle collision, sports injury, fall from heights. Poor posture is another cause of upper back pain. If you have poor posture, your spine and body are not aligned. This can place pressure and stress on your back muscles. It's a common cause for one-sided upper back pain. Other symptoms of poor postures you can have neck pain, shoulder pain, headaches, trouble breathing. Okay. You have osteoarthritis. So osteoarthritis occurs when the cartilage at the end of your bones break down. It can happen anywhere in the body, but it's the most common type of arthritis in the back. Then you have myofascial pain, myofascial pain. Another cause of upper back pain is myofascial pain syndrome, a condition that creates sensitivity trigger points in your muscles. Placing pressure on these points causes ache and pain. Okay. Of upper back pain can ranges from pancreatitis. So pancreatitis or inflammation of the pancreas causes pain in the upper abdomen. The pain can radiate to your upper back and worsen after eating. Okay. And kidney stone. When a kidney stone leaves your kidney, it can cause dull, one-sided pain in the upper abdomen. This pain again may radiate to the other parts of the body, includes the upper back. And you have heart attack. This is very important, but it can cause chest pain that spreads to your neck, jaw, and upper back. What are the other causes? Obesity, because you're carrying so much extra weight on your body. This can cause stress for your spine and your upper back muscle and leading to upper back pain. Lack of physical activity, so neglecting movement and exercise weakens your back and core muscles. This can cause pain throughout your back, including upper left side of your back and also right side. Aging. The natural wear and tear of aging is a common cause of back pain. Okay, it often starts around 30 or 40 years old. Okay, smoking. If you're a smoker and you injure your back, you're more likely to have a longer lasting back pain. Smoking slows down your blood flow to the spine and makes it more difficult for the body to heal quickly. Okay, so what is the Chinese medicine's perspective on upper back pain? So upper back pain, in Chinese medicine's term, we call it pain in the Gaohuang acupoint. So as you can see, Gaohuang is actually located around this area, okay, around this area. So roughly just on the border of your scapula, okay, so sort of between the vertebrae and the scapula, so in between there. Okay, so in Chinese medicine, Gao Huang pain or upper back pain is considered as a very difficult symptom to treat. It's because Chinese medicine believes that pain in the Gao Huang is due to accumulation, long-term accumulation of stress, overexertion, tiredness, or invasion of external cold evil, and as a result, the pain occurs. So it's a long process of accumulation of these factors, and then it manifests itself as upper back pain or Gao Huang pain. So this kind of thinking is really unique to Chinese medicine, because in Western medicine they are more prone to examine for example, any abnormalities occurring in the body. So anything that they don't see, for example, as I talked about it before, the cold invading the body, or stress, or tiredness, they tend to not see those things as a cause. Okay. So what is Gao Huang pain? So pain in the upper back for Chinese medicine. So in today's term, we call it myofascial pain in the trapezius muscle area. So trapezius muscle, it goes from here and connects to your shoulder and then back as well. So it's like a triangular shape. Okay. So so oftentimes this kind of pain will occur on one side or either side, and then it can travel up to your shoulder or your neck, because if you look at the muscle, it is all connected to all the way up to the head area. And also the Gao Huang area, the Gao Huang acupoint, is actually on the bladder meridian as well. So you can see the bladder meridian covers, there's two lines that runs along the spine here, just on the side of the spine. Okay, so it's actually very, very close to the bladder meridian. Okay. So as I said before, tiredness, overexertion, sleeping late, catching a cold, wet weather, dampness invading the body, also emotional disturbance or depression, oftentimes, and these factors can also make the pain worse. Okay, exacerbate. Sorry, that's the word I'm looking for. Exacerbate the pain in your upper back. Okay, so firstly, I want to talk about overexertion and overtiredness, how it can actually contribute to upper back pain. Okay? The accumulation of your tiredness and your stress will tend to display itself or manifest itself as pain on the Gaohong meridian point. Okay, so actually if you look at Gaohong point, it's actually very, very close to the bladder meridian, as well as the, I don't know if you can see this properly, as well as the small intestine meridian. Yeah, so small intestine meridian runs along the pinky all the way up in the inner side of your elbow, up, okay, and then to the shoulder and zigzags across and then up to the head. And the bladder meridian goes from the head all the way down to your legs, okay, to the back and then all the way down to the legs. So Gaohong point is actually very, very close to where the small intestine and the bladder meridian meets, okay? And these two meridian lines are both what we call the Taiyang meridian systems, okay? So the bladder meridian is the foot Taiyang bladder meridian, and then the small intestine meridian is the hand Taiyang small intestine meridian. Okay. And actually, so when the bladder meridian is doesn't have enough energy, it actually can also affect other meridians. In this case, the bladder meridian actually affects the spleen meridian the most, okay? Because they have a very close relationship. So the, sorry, excuse me there, I just need to look at this. So the bladder meridian is the Taiyang meridian, like I talked to you about, I said before. So Taiyang, Yang is actually, do you know in Chinese medicine or in Chinese philosophy, we talk about Yin and Yang. Yin is like essence or the substance. Yang is like energy, and they actually exist. It's Yang is like the sun, and Yin is like the shadow. Okay, so look at it that way. So in Chinese medicine, on the outside, the arm, our whole body can actually be divided into Yin and Yang as well. So let's just look at the hand, for example. On the inner side is the Yin side, and on the outside is the Yang side. Okay, so at the back is the Yang side, and at the front is the Yin side. And if you think about it like this, in the old days, that the farmers, when they plant the vegetations, or they're trying to grow vegetations, they bend down, and so their back is constantly exposing to the sun. Okay, so the back side is the Yang side, that's the outer side, and the inside is the inside. Okay. So the bladder meridian is Taiyang, it's Yang, okay, and the spleen meridian on the foot runs along the inside of the thigh and up, and that's the inside. So it's Tai-Yin. So Tai-Yin and Tai-Yang actually are opposite to each other. So that's why the spleen meridian is actually very closely associated with the bladder meridian, okay, because one is Taiyang and one is Tai-Yin, okay. So when the Taiyang meridian doesn't have enough energy, the Tai-Yin meridian is also affected, and so it makes the Tai-Yin meridian more tired as well. You can look at it like that, okay. and as well as the small intestine meridian, which is also a Taiya meridian on your hand. So because the Gaohong meridian is meridian point is actually very close to the bladder and small intestine meridian. Okay. And the second cause of your upper back qi and blood not flowing well. So there's a blockage of qi and blood in the chest area. So therefore, if you have blockage, then it will result in pain, as the Chinese classic says. So you might wonder, okay, well, blockage in the chest, okay, qi and blood blockage in the, yeah, upper back is the back side, not the front side. Okay, you might wonder that. But in Chinese classic, we say, when you have illness in the top at the above, then we look for treatment below. If the illness is on the left side, then you look for the right side to treat the illness. If you have illness at the back, then you look for treatment at the front. Okay, this is what the classic says about treating illness. So therefore, front and back, left and right, up and down are actually all connected, because if you can use the other side to treat the sick side, then that means they're all connected. So therefore, the blockage of blood and qi at the front can transfer to the back as well over time. Okay, it might begin at the front, but over time, if you don't treat the disease or the symptoms, it might end up showing in the back as well. Okay. And another way to look at it is actually the Gaohong meridian point is actually right behind the chest, your heart and your lungs, right? So therefore, when your Gaohong meridian point or the upper back is hurting, what you need to worry about the most is probably not about the pain itself, but you probably have to think about, okay, maybe there are some problem in my chest or my lungs or the heart, and maybe there will be some unforeseen illnesses that can occur in the future. So you just have to think a bit more when you have an upper back pain. It might not just be as simple as it seems. And the third cause is external cold, wind, and dampness invasion. Okay, and once the external evils they invade the body, particularly wind, cold, and dampness, once they invade the body, they tend to stay in the body. Okay, and then one of the first meridians that gets attacked, most prone to attack, is the Taiyang meridian, because the Taiyang meridian is the bladder meridian, and it is really in charge of protecting the body, looking at it as a layer, your first layer of. When your body becomes weaker, your defense lowers, then the external evil, wind, dampness, and coldness invades the body. Okay, and this is why we see many people end up having sudden heart attacks or die of sudden heart attacks. This is often because they have coldness congealed in the body, because they didn't treat the coldness when it first appeared. They just left it there for many years, and then at the end the body just can't cope, and then it triggers a very severe illness such as heart attack. So what can you do to make these upper back pain disappear? So first of all, probably the most easiest way is you can use your finger, just use your hand, and to massage the gaohong point, okay? Or to knead, you can grab the skin and then try to knead the gaohong point, which is along the area between the spine and the shoulder blade, okay? It might be a little painful, but if you persist, it can work very well. You can see quite good results. Second way to treat it is you can use heat packs, okay? So using some heat source, massaging or pummeling the bladder meridian or the upper back between the shoulder blades. Okay, so you can do all that kind of stuff to help it. So pummeling, massaging, and doing tuina on the upper back can really assist in energy and qi flow in the bladder meridian. Okay, and when your qi and blood flows well in the bladder meridian or upper back, then the pain will lessen or disappear. Okay, so you can ask your partner, your wife, or your friends or family to do that for you. I know it's kind of hard, or you can even get a tool to just help yourself in pummeling the back. Okay. Oh, one other tool you can use is you can grab a tennis ball, okay? Something hard and round, okay? So that's also one solution you can look at if you have to do it yourself. There's one other tip. So it's when you have gaohong pain or upper back pain. This one meridian code here, one meridian point here is called yuji. Yuji is actually just on the edge. See the darker skin and the lighter skin on the edge of the thumb. Okay. Yeah, just right here, and in between, sort of in the midway between the bones. It's sort of just on the side of the bone, and you can massage that point to help alleviate the pain in your upper back, in the gaohong area. Okay, so that's the tips for you today. And next time I will choose a different topic and talk about that. And thank you for listening. And if you have any questions, please don't hesitate to contact us on at Center Balance. We're based in Dinsdale, and we have a group of excellent acupuncturists and herbalists. So if you have any questions or any problems, just come and see us. Thank you very much. See you next time.